The most common spot in the body to hurt is the low back. Low back pain. It's the number one area that hurts. It's the number one reason that anybody ever calls a doctor, a chiropractor, a physical therapist, whatever. Low back pain. Judy Foreman wrote a book called A Nation in Pain, and she said out of the 238 million adult Americans, 100 million have chronic pain. 100 million. So rough numbers, one out of two. The most common spot is the low back. So a lot of what I deal, and that's why I wrote the first book I wrote, is called Happy Back, because it's such a chronic problem, myself included. I've had off and on backaches for 40 years. But my back is well managed, and my program in my office is centered around sharing with people what I do every day for my back. Before you do any of my suggestions here, check with your doctor first and get clearance. Check with your chiropractor if you're seeing one, or physical therapist, or medical physician, whoever is under your care, that the recommendations here are appropriate for you. Okay. Again, if you just had recent surgeries, or if you've got spinal canal stenosis, or nerve root compression from disc herniation or fracture, or cancer, or tumors, or whatever it is, you have contraindications doing stretches and exercises and so forth. Okay. For the rest of us, we have to chip away at this. And I have so many stories, because I have over 4,000 patients that I've had in my office in Woburn, Massachusetts, and thousands of others that I have assisted with in all of the internships prior to having my own office. And just with that huge data input, plus my own back, plus both of my parents having serious back problems when I was very young, plus my older brothers having serious back problems earlier in their lives, and I saw the chiropractic help them all, myself included. I have this program of things that I do every day. So I start off with spine stretches. Spine stretches to my lower back. I refine those at my first internship in 1989 when I graduated chiropractic college. These chiropractors that were mentoring me were teaching all of their patients spine exercises in conjunction with the chiropractic work. So I learned the exercises so I could teach the patients, and I thought, gee, I should be doing these as well. Plus we learned some exercises in school, so I put together this package, and I've refined it over time. It's still under refinement all the time, but I have these stretches that I do a good set in the morning, I do some in the middle of the day, and I do some at night. So I ask you to do the same thing. If you've got an acute problem, you can start doing these things. If you have a chronic problem, absolutely you want to be doing it. And if you have no problem, you want to make sure you don't have a problem in the future. It's like brushing your teeth. If you have a tooth problem, you brush your teeth, and if you don't, you want to make sure you don't have any, right? So you get on the spinal stretching regimen. The second thing you want to do is get an evaluation, get your spine looked at. How do you find a chiropractor if you've never been to one? You just ask people around you, somebody in your family, co-workers, friends, neighbors. Somebody is going to a chiropractor, very likely that you know, and then just get a referral for a workup and say, I'm here to get a workup. You might have a chronic problem that you haven't had appropriately addressed. Or maybe you just walk in for a wellness situation to be evaluated to make sure you stay that way. Or you're just looking for the next step up. You have this problem that you want addressed better. So I've gone through this whole management technique for my own back, and I really haven't lost any ground in 20 years. My back is doing better. If we had a parallel universe and I had a back problem in this other universe that I didn't do all of these techniques and tactics for, I don't think it would have turned out quite as well. So I'm doing pretty good. I don't have acute flare-ups, but if you make me sit for a long period of time, my back will ache. And if you make me stand in one place for a period of time, my back will ache. But if I'm moving around and I'm using my body and I'm exercising regularly and I'm doing the spine stretch program that I talk about, my back does a lot better. I'll give you one example of a 91-year-old man who's coming in to see me right now. He's been a patient for 2 years, never been to a chiropractor, and he came in a walker. And he literally is bent over like this. No exaggeration. We've all seen it, right? So he's coming in like this, and he's not feeling so hot. And because he's not been feeling so hot for so many years, he's kind of grumpy. And he didn't communicate very much, okay? So we start working on him. I worked on him 3 times a week for a month. Then we worked, the second month was twice a week for a month. And now we went from here to here. So he's better. And he never looked at me because he didn't have the muscular effort to look at me. Now he'll come in, he'll see me, he'll lift up and wave and smile. Hi. He wasn't doing that in the beginning. And his daughter, who brings him in, says his mood is better. He's sleeping better. His digestion is better. And as I said on a recent show, he's eating his food better because he used to be so bent over, he was coughing and choking every time he was eating and drinking. He's not coughing and choking anymore because we moved his esophagus from horizontal to more vertical. It was just a mechanical thing that he's just getting better there, never mind changing the neurology in the area as well. So it's never too late to get started. Never too early and never too late to get started. Here's somebody that we're making a difference in. I can tell you about another 91-year-old man. Similar kind of situation. Walked in with a cane, pretty grumpy, hurting. By the time we're done, he's smiling and happy. I can talk about the 97-year-old man. I can talk about the 94-year-old woman that comes to see me, and so on and so forth. So, and are they getting perfect? No, of course not. But are they getting a better quality of life because, number one, they got under chiropractic care, and number two, I showed them a couple of exercises to do at home? You bet. What if we take all of these people, these 100 million people in chronic pain, a good chunk of them with chronic low back pain, put them under a little regimen of care, see what we can do, and then give them a couple of exercises. The first man that I was talking about that's like this, he has one exercise at home. I only gave him one. And all he does is this. He sits and he pulls up like this, as tall as he can. And when he started, he could get here, and now he can get here. So he's activating all these muscles, taking pressure off the discs and joints in his spine, which is causing his chronic pain. He is 50% better, his words, 50% better in 2 months. That's what we're talking about. Is everyone in his condition who's 91 with chronic pain, bent over like that, going to get 50% better in 2 months? Probably not. But in his case, that's an example of how you can get there. One exercise that he does diligently, I know that because his kids come in to see me as well and report in, and he's doing good, he's doing well. So people that have a little bit more of ability, we give them more exercises, not just the posture exercise, number one, which is a pull back and hold, but then they get some other stretches, and you can go to my video page and check out the spine stretches. They get some twisting ones, right? So they do these morning and night. Then they'll get some side bend ones. They do these morning and night. And if somebody is able, then they get on their bed. If they can't get on the floor, they get on their bed and they roll the knees side to side. They might do 10 of those, and then they pull their knees up and down like that 10 times. Takes 90 seconds to do the exercises morning and night. So that's how we get started, along with the chiropractic care in the beginning. If you're new to chiropractic, I will tell you I won't make any promises. And keep in mind, if you go a couple of visits and you don't notice improvement, give it some time. Give it some time. If you sprain an ankle and you go to the physical therapist the first day, you know you're not going to get better that day. You want to, the physical therapist wants you to, everybody wants you to get better in that first day. Not going to happen. You know it's going to be a process. So just keep in mind this is a process. And on this show here, I've talked about these people in chronic neck and back issues that have taken months to even years for them to get better. But along that way, they just notice they keep on getting better, so we just keep on going, and they're happy that they did. Because at the end of that, their quality of life, and that's what it's all about, the quality of life is better. That's how we deal with chronic pain in my office. We have the chiropractic part of it, we've got the home exercise part of it. But then we start looking at other reasons that people can have chronic pain. So we look at Joseph Maroon, the orthopedic surgeon who did that study, who took people with chronic low back pain and only gave them omega-3 fish oil and knocked out chronic pain in the vast majority of them. The vast majority of them stopped taking their pain medications and said, I'm going to continue taking fish oil because it worked, because it cranked up the anti-inflammatory pathway. Well, now we're dealing with anti-inflammatory supplements. That's another thing in our toolbox that we can get into that can knock down pain. I've seen that happen in my office as well. So we're doing the chiropractic thing, we're doing the spine exercise thing, then we do the supplement thing, and of course we visit the things that can really matter, like what you eat will determine how much pain you have. So if you're eating things that taste good, you're going to have more pain. If you eat things that taste bad, you're going to have less pain. It's as simple as that. The closer it is to dirt, the better. That's what you're going to deal with. Or to keep it all joking aside, if you eat real food, more chance you're going to have less pain. Well documented, seen it happen in my career, something to look into. 80% of people, as a rough number, are chronically dehydrated that come into my office. If you're chronically dehydrated, your cells in your body don't work right. Make sure you're getting in enough water. Check with your doctor if you have any medications to make sure it's okay to take water. Don't take any supplements until you check with your doctor, particularly if you're under medications as well. So you look at that, and then we have to look at chronic stress. How many people will say, I'm feeling good, how come? I've had a 2-week vacation, I got a raise, my family is doing wonderful, and everything's just happy. And how's your pain doing? What pain? Right? Or somebody will say, I just went through a rough patch in work, and the family's upside down, and this and that, and we've had this thing called COVID for 5 years, and whatever is going on. And they have more pain here, and more headaches here, and more back pain down here. So then you have to start dealing with the chronic stress aspect as well. So you can see we've got a lot of things in here that we can take many people, not all, but many people, from chronic pain to at least less pain and feeling better. Maybe they're taking less medication. That would start making a dent into the opioid crisis that we have. And the more we get people off or reducing their non-steroidal anti-inflammatory medication situation, that's going to be better for everybody as well, because you're going to avoid all the harm and the side effects from taking those long-term as well. So that's the program of things. Get started with some simple spinal stretches on my video page. Get a consultation with a chiropractor. See if we can reduce some of your long-term pain. I'm Dr. Scott Fuller.